If you or your child have scoliosis and you've been told that chiropractic care can help with scoliosis, the reality is that may be wishful thinking. People are told by chiropractors and friends and family all the time that chiropractic adjustments can fix their scoliosis or potentially keep it from worsening. The reality is there's no evidence to support that chiropractic adjustments can improve scoliosis or keep it from getting worse. But that doesn't mean that chiropractic care doesn't have a role in treating patients with scoliosis. Now, in this video, I'm going to tell you the scientific facts about what chiropractic can and cannot do for scoliosis and what treatments are and are not effective at treating scoliosis. Hi, I'm Dr. Chris Gubbels, leading authority on the non-surgical treatment of scoliosis. And what's interesting about this topic is my background. I'm also a chiropractor. So I'm uniquely qualified to talk and give you information on this subject. Now, if you're a parent watching this and you have a child with scoliosis, be sure to click on the link below and get our free ebook on the 4 crucial factors to choosing the right treatment for your child's scoliosis. And if you're an adult watching this video, be sure to get our free book called Scoliosis Has No Age Limit. Here's the thing. All big curves start off as small curves. And if you have a child with scoliosis, there's a critical window of opportunity for the most effective treatments for scoliosis. And once this window is gone, although we can still generally treat scoliosis, the goals and the potential outcomes start to change, especially if your goals are to reduce the size of the curve. And if you're an adult watching this, you want to make sure if you're going to get treatment, you get the most out of your treatment. And whatever you invest your time and energy and money into, you want to make sure you're getting the results that you're seeking. Now, there's a lot of misinformation on scoliosis treatment. And the reality is most healthcare professionals know very little about scoliosis and how to effectively treat and manage scoliosis. This goes for chiropractors, physical therapists, general practitioners, medical doctors, pediatricians, pain management specialists, and even spinal surgeons. Now, many spinal surgeons know a lot about scoliosis, but I find that many of them actually know very little or relatively little about the non-surgical or the conservative treatment of scoliosis. See, you actually learn very little about scoliosis in professional school. In chiropractic school, you learn a little bit about how to properly measure and evaluate scoliosis. You learn about the different types of scoliosis and what it looks for, but you don't know much about what can or can't be done for scoliosis. This was brought up probably 1 hour block during a musculoskeletal course. And if you're a medical doctor or a general practitioner, you know even less about this. And if you're a physical therapist, maybe it was never even brought up in your school of education. And then when you go to school, there's so much information you're trying to learn to pass boards and exams that you don't retain a fraction of the information you were ever taught. So if the most you ever got in this subject was maybe during a 1 hour lecture, and then amongst all the other things you're going, you probably know nothing about this at all. Even in my own experience as a chiropractor, I admit I knew virtually nothing about scoliosis until I began the path of going down to actually specializing in scoliosis. When I went to my first seminars and started doing my first postgraduate training on scoliosis, I immediately knew that I knew nothing prior to going to those seminars. So the information you get from most providers is maybe what they actually believe to be true, but most people are misinformed, including most specialists. But the reality is most providers are misinformed, or they just have mis or inaccurate information on what scoliosis is and what is and is not effective at treating it. Now, to answer your question about scoliosis, and now to get back to if chiropractic care can treat scoliosis, I want to start by telling the story of a patient. And I get a chance to talk to healthcare providers of all kinds of professions, but I especially get asked to talk to chiropractic groups all the time. And I ask frequently, who in here believes they can effectively treat scoliosis? And when I talk to a large audience, some people raise their hand, but a lot of people are nervous. And you can tell, although in private they may say they're good at it, if they're really called out into a larger group, most people are pretty hesitant and they start to question their treatments. So let me show you the story about a patient with scoliosis that actually sought out chiropractic care. So this is a 13-year-old boy that was diagnosed with scoliosis in August of 2015. He was referred to an orthopedic surgeon who just recommended to watch him wait. He was told it wasn't really a concern to come back in a year. And when he came back in a year, the curve actually had gotten 15 degrees worse, and it went from 15 degrees to 33 degrees. Now, at this time, he was recommended the Boston brace, which is the typical brace used at most orthopedic center. His mom was really hesitant because she wore a Boston brace when she was younger because she had scoliosis, and she still ended up getting fusion of her spine. So after no treatment, 3 months later, they went to a provider that also does or uses the Scoli brace. And this was in November 2016. And this was the initial evaluation. The curve was now at 38 degrees. So it had continued to progress over 3 months from 33 degrees to 38.5 degrees. This was how the patient presented an exam. You can see over here, there's a curve right here. That's why there's a bend here and an indent there. You can see that curve from the back. You can see the scapular winging. You can see the scapula sticking out, and you can see this big rib humping. Now, at that time, the patient was recommended to do a Scoli brace, to do scoliosis-specific exercise, but by a chiropractor that had specialized training in the management of scoliosis. But the patient's parents decided to just try general chiropractic, or basically go just get chiropractic adjustments. So this was the patient in August of 2016. This was then in November 2016. And then this was after they tried traditional chiropractic or just getting chiropractic adjustments. And this is on January 2017. So 2 months after this, the curve progressed even more, and now it was at 45 degrees, and they were actually recommended to get surgery. Now, at this point, the parents realized that traditional chiropractic care was not helping stop the curve progression. It definitely wasn't getting the curve fixed. So at this point, the parents went back to the Scoli brace provider and decided to follow through with the initial recommendations. This was the patient doing scoliosis-specific exercise. You can see the patient over here on the left. This is when they're not doing anything. This is the patient going through correction. And this is the patient over here on the right, holding their body in correction, doing Scoli balance, scoliosis-specific exercise or rehabilitation. This was the brace that was made for the patient. This is the Scoli brace that actually puts the body in the opposite position. You can see right here, it's moving the spine into this area. It's actually untwisting and unwinding the spine. So this was the evaluation, initial evaluation back in May 2017. This is the patient post-treatment. And you can see a very dramatic difference in the alignment of the spine and in the shoulder blades and in the symmetry in the trunk from left to right. This is that rib pumping before treatment. This is after. This is with the Scoli brace and scoliosis specific rehab. This was the curve when the patient started doing the scoliosis brace and scoliosis specific rehab or Scoli balance. This is the patient afterwards. So the curve at this point reduced 15 degrees with the most appropriate treatment. Now, mind you, they were going to a chiropractor, but it was a chiropractor that has specialized training in scoliosis, and they were doing a scoliosis brace and scoliosis specific rehabilitation. So this is when they started with a chiropractor that's trained in scoliosis work, and this is post-treatment. And you can see the dramatic difference. So we had this patient that progressed with watch and wait. Watch and wait did nothing. They went to a traditional chiropractor. The curve continued to worsen, just getting chiropractic adjustments. And then when they actually got specialized scoliosis treatment, a custom scoliosis brace and scoliosis rehabilitation, not only did they stop the curve progression, but they actually reduced the curve down to under 30 degrees. So here's what we know. There is no scientific evidence that shows that manipulation or chiropractic adjustments or spinal manipulation is an effective treatment in stopping the progression of scoliosis or reducing scoliosis. So we have to understand what scoliosis is to understand why spinal adjustments cannot fix scoliosis. And this reminds me of the time when I got a call from a friend whose daughter was diagnosed with scoliosis. So here's what's interesting. I'm a chiropractor, his wife is a chiropractor, but the mother, which is ex-wife, was actually a nurse. So I talked to him about scoliosis treatment, and he was really upset because they were recommended a brace. And I explained to him, I said, actually, a brace is the most effective treatments. But his wife is a chiropractor. I was telling him that she effectively treated scoliosis all the time using a technique called ABC. And I know there's no way that could be effectively treating. I saw her curve, it's a big curve, and I knew this person needed a brace. The chiropractor, his now wife, was actually saying, no, we can treat this with adjustments and the technique I do. But, he wasn't going to have his wife treat his child because that was going to create problems with his ex-wife. So they had me talk to a doctor that worked in her office. And it's interesting, he didn't know really much about my background. He knew who I was, but he didn't know my background or my level of training. I'm one of the foremost experts in non-surgical treatment of scoliosis in the whole Midwest and Western states. So this chiropractor explained to me about scoliosis and how it's a twisting and winding and how he fixes it. And it was like, oh my God, he has no idea what this is, but he actually believes this, but he didn't really understand what scoliosis is. So let me explain to you what scoliosis is and what scoliosis is not. So by definition, this is from the Scoliosis Research Society, scoliosis is defined by a lateral bending of at least 10 degrees with rotation. And this is critical. There must be rotation in the spine for it to actually be scoliosis. And this is because true scoliosis is a three-dimensional spine deformity. So what happens in idiopathic scoliosis is something genetically gets triggered where part of the bone grows slower and part of the bone grows faster. And then the bone grows asymmetrical. When you look on this picture, you can see the vertebrae growing asymmetrical. Part of it's growing slower, part of it's growing faster, and the spine starts to twist and rotate. And that's where you get the rib humping. And then you need to know that all true scoliosis is a bone deformity. It's not a misalignment. The bones are growing deformed or asymmetrical, and that's what's driving the misalignment. So when you look at this scoliosis, you can see these vertebrae over here are really wedge-shaped, and then you see there's a lack of curve from the side. But it's a bone deformity. The bones are growing asymmetrical. You cannot change that with spinal manipulation. Now, this is a great video actually showing what scoliosis looks like. You can see it's a twisting, you can see it's a rotation, and it's a deformity of the spine. It's not a simple lateral bending or misalignment. So this is a really important x-ray to look at. And when you look at this, I want to know, what do you see and what do you not see? And my question is this actual true scoliosis? If we get closer, you can see there's no rotation. These are the spinous processes, the bumpy parts you see in the back of your spine. And when you have rotation, you're going to see that bending towards one side. You will also see a difference in the space in the ribs where these are more symmetrical. So this is a postural issue. This is not true scoliosis. This is basically the patient is standing bent. It's not a true scoliosis. And this is important because I think this is what happens. Because I get chiropractors that tell me that, hey, I adjust my patients and their scoliosis gets better. And when they tell me that, there's one of two things that are happening. So I think they actually believe that. One, a lot of times they're mismarking the scoliosis. They're not properly evaluating or they're not marking the curve properly. So they may think that it's improving, but they're just not marking the same or accurate. And what also happens is we know spinal manipulation can help with posture because when people get adjusted, like you have receptors in all of your joints, muscles, ligaments, and tendons, and they send information to the part of your brain called your cerebellum, and your cerebellum is responsible for things like posture and movement, coordination, all those things. What happens to a lot of people, I believe, is they go to see a chiropractor because they have bad posture or they have pain, right? And maybe they're standing crooked or bent, or maybe they have an anatomical short leg, or maybe they're bending or twisting because they have antalgic pain. And the chiropractor does an x-ray and looks at them and he sees the spine is bent, so they think it's scoliosis. But it's not a true scoliosis. It's like a pseudo or fake or a postural scoliosis. It's not a true deformity. And then afterwards, they work on them for a while and the patient stands more upright and they look straighter, their x-rays look straighter, and the chiropractor thinks they actually fixed scoliosis. But what they actually did is they fixed a postural issue, or the person was in pain and leaning, an antalgic lean, but they're not actually truly fixing a deformity. And then what happens later on is they get someone that actually has scoliosis, that's a progressive scoliosis, and they think, oh, last time I was effectively treating scoliosis, I can effectively treat it now. And so they adjust the patient and the patient gets worse and worse. And then when they realize the case got out of their hand, it's kind of an oh shit moment, then they refer them to a specialist like me. And many times we can still help that patient. But the reality is if we could have got them when the scoliosis first presented, the outcomes and treatment would be even better. So let's take a look at what I mean by this. So here's a patient, for example, has a functional, a pseudo, a postural scoliosis. You see the patient leaning to the side. It looks like there's a curve right here. But you also notice that the pants are uneven. And this is the patient that has one leg shorter than the other. So this is the person with an anatomical short leg, and that causes what presents like a scoliosis. Now, if that's not corrected over time, that could actually lead to a structural scoliosis, potentially. This could be caused by a short leg, trauma, like the patient is antalgic, they're in pain, they're having muscle spasms, they're doing something repetitively, but it's not a deformity. There's something causing this postural type thing. And so the doctor works on them over time and they get better. Here's something to know. Improving postural curves with chiropractic adjustments does not mean that chiropractic actually improves an idiopathic or degenerative scoliosis. They can improve postural issues with things like a lift, with corrective mirror image exercises, with things like chiropractic adjustments. And that's what we see all the time when chiropractors think, or even physical therapists think, they're improving scoliosis with chiropractic adjustments. They're not true scoliosis. They're more of like a postural type issue where the patient is holding themselves unintelligent because of pain. And I know this 100% because when I was young in practice, I thought the same thing. I can actually remember this set of x-rays I had up in my office showing a pre and post. Because a patient come in, I thought, oh, they have this huge scoliosis, and I worked on them, and just a month, we reduced that thing huge. What it was, the patient was in severe pain, they had an intelligent lean, we adjusted them, and they got better. Because I was a traditional chiropractor before I ever got into scoliosis work. So even myself was guilty because I had a limited knowledge, and I didn't know what I didn't know and understand. So first of all, the first lesson is scoliosis is a true spine deformity. The spine is actually growing asymmetrical and deformed, or it's a degenerated condition where the bones are breaking down and decaying, and they're breaking down and deformed. That's what we see in older adults. 2, chiropractic adjustments cannot fix a true scoliosis, but it can be effective in actually a fake or postural scoliosis, which is not a deformity rotation, as the patient is standing asymmetrical. But here's the thing. Chiropractic, I do believe, has a role in patients with actual scoliosis. Because when someone gets true scoliosis and their spine starts to rotate, their spine starts to stiffen. And the stiffer someone gets, the harder it is to correct or reduce the size of the scoliosis. So chiropractic care, traditional chiropractic care or spine manipulation can be effective in 1, getting joints to move, and 2, reducing pain for someone that's has scoliosis. So it can be like a nice adjunctive treatment with scoliosis. We just can't say adjustments can actually treat scoliosis on its own. Now, with that being said, there are a couple of specialties within chiropractic or chiropractic techniques, or doctors training a couple specific techniques that have specialized training in scoliosis. One of those is called chiropractic biophysics, which is an advanced technique that is the most researched method out there in the non-surgical treatment of structural misalignments. And there are doctors that are trained in chiropractic biophysics that are also trained in doing scoliosis-specific rehabilitation and doing a scoli brace. And then there's also a technique called clear. And doctors in clear have a specialized training in scoliosis. And many doctors that are doing clear also do custom bracing or scoli brace. What's interesting, both in the clear technique and the chiropractic biophysics technique, these techniques involve a specific type of traction that puts the body in the opposite position. And when people are doing this specific type of traction, it makes scoliosis specific treatments possibly even more effective. Because as I previously mentioned, when the spine starts to rotate, it gets stiff. The stiffer the spine gets, the harder it is to change. And when we do these aggressive tractions, that can add a lot of increased mobility to the spine. And when the spine is more mobile, then we can have bigger influence with things like bracing. But what's also important to know, you don't want to do things that put a lot of mobility in the spine if you don't also have a way to strengthen and stabilize the spine. So when we're doing tractions to increase mobility, we are also stabilizing and strengthening with custom bracing and scoliosis-specific rehab. So that leads me to my last point. What treatments are effective in the non-surgical treatment of scoliosis? So to recap, things like chiropractic, general physical therapy, yoga, massage, acupuncture, Pilates, all that stuff is good for your overall health many times. It can help reduce pain. It can help increase movement. And so there's a lot of benefits to those things. But those things specifically have not been shown effective to slow the progression of scoliosis or reduce the size of scoliosis. But they may be used in conjunction with other scoliosis-specific treatments. There's two things specifically that have been shown effective in treating scoliosis outside of surgery. One of those is scoliosis-specific exercise or rehabilitation. These are things like Schroth and ScoliBounce. How scoliosis-specific rehab or exercise is different than traditional physical therapy is in scoliosis-specific rehab, we actually teach you how to put your body in a correct position. We actually teach the patient how to correct their scoliosis in a 3-dimensional manner. And then we teach the patient how to strengthen and stabilize their body, and we work to strengthen and stabilize the body in a 3-dimensional correct position. And then we're going to incorporate the corrective exercises into someone's everyday activities and show them how to put themselves in a 3-dimensional correct position while they're doing things they already do in their everyday life. Then there's a lot of education that goes along with it too. The second treatment that's effective is custom bracing. And not all braces are the same. I believe ScoliBrace is the most effective for treating both adolescents and adults. We even treat juveniles and infants. But custom bracing can be really effective. Now, in some cases, you can treat scoliosis just with scoliosis-specific exercise or custom bracing. But in many cases, in more severe cases, we know we get the biggest benefit and the greatest results when we combine scoliosis-specific exercise like ScoliBalance and custom bracing like ScoliBrace. So if you're watching this and you see your child has scoliosis or you have scoliosis and you're wondering, what is the most effective treatment or how likely is my curve to progress, click on that link below and request a free discovery call. That gives you a chance to talk to me one-on-one. We'll review your scoliosis, how likely it is to progress, and what treatment options are the right treatments for you and what treatments you're a candidate for. Now, to learn more about and in depth about the most effective treatments for scoliosis, be sure to click on our next video, and I'll see you there.